Hi, my name is Jessica, and this is my Caregiver presentation on dysarthria. What is dysarthria? Dysarthria is a group of motor speech disorders caused by damage to the movement control systems of the central or nervous system. Aspects of speech production affected in dysarthria include respiration, phonation, articulation, and prosody. Unlike apraxia, dysarthria involves weakness of muscles and incoordination. Signs and symptoms. Depending on the severity and location of the damage to the central or nervous system, a person with dysarthria may experience slurred speech, speaking softly or barely able to whisper, slow rate of speech, rapid rate of speech with a mumbling quality, limited tongue, lip, and jaw movement, abnormal intonation when speaking, changes in vocal quality, either known as nasal or sounding stuffy, hoarseness and breathiness. Causes. Dysarthria is caused by many different conditions that involve the nervous system. Some include stroke, brain injury, tumors, cerebral palsy, Parkinson's disease, Lou Gehrig's disease, Huntington's disease, multiple sclerosis, and some medications. Assessment. During a diagnostic evaluation, it's easy to confuse the dysarthrias, as many of their characteristics overlap and more than one type may be present. To complete an assessment of dysarthria, it's important to obtain a complete oral facial examination and good speech sample at structured levels and in continuous speech. Formal tests, such as Enderby's-French dysarthria assessment or Yorkston-Buchelman and Trainer's assessment of intelligibility of dysarthric speech, are useful assessment tools to be able to establish a differential diagnosis. Things to look for are prosody, resonance, articulation, phonation, and respiration. There are 7 types of dysarthria. The first one being flaccid. The site of lesion is in the lower motor neurons, and some of the characteristics are strained and hoarse voice, hypernasality, and slow and precise articulation. It's accompanied by swallowing and drooling difficulties. The second one is spastic. The site of lesion is in the upper motor neurons. Some of its characteristics include muscle weakness, greater than normal muscular tone, imprecise consonants, harsh voice quality, hypernasality, strained, strangled voice quality, and reduced range of motion. The third one is ataxic dysarthria. The site of lesion is in the cerebellum. Some of its features are excess loudness, tremor, and irregular articulatory breakdowns. Intonation, pitch, volume, and difficulty with alternate tongue movements can also be seen. The fourth one is hypokinetic. The site of lesion is in the basal ganglia. It includes breathy monotone voice with reduced loudness, and articulation tends to be accelerated and imprecise. Hyperkinetic. The site of lesion is found in the basal ganglia. Its features are strains and hoarseness and voice arrest. The sixth one is unilateral upper motor neurons. The site of lesion can be found in the unilateral upper motor neurons or the frontal lobe. Some of its characteristics are weakness in the lower face, lips, and tongue on the opposite side of the lesion, imprecise articulation, slow rate, harshness, mild hypernasality, irregular articulatory breakdowns. The last one is mixed, and it's a mix of symptoms mentioned above. Treatment. Treatment may be different for each type of dysarthria. It's all dependent on the cause, type, and severity of the symptoms. Therapy can be implemented with an SLP that can work with an individual to improve communication abilities. Asha mentions treatment goals in the session that can be geared towards, including slowing the rate of speech, improving the breath support so the person can speak more loudly, strengthening the muscles, increasing tongue and lip movement, improving sound speech production so that speech is more clear, teach caregivers, family members, and teachers strategies to better communicate with the person with dysarthria. In severe cases, learning to use AAC devices also can be simple gestures, alphabet boards, or electronic or computer-based equipment. Below are some treatment examples that you may want to carry over at home depending on the type of dysarthria. Better communication. ASHA also recommends various tips for the listener and speaker to utilize with your loved ones. Some tips for the listener include: reduce distractions and background noise, pay attention to the speaker, watch the person as he or she talks, let the speaker know when you have difficulty understanding him or her. Repeat only part of the message that you understood so that the speaker does not have to repeat the entire message. If you still don't understand the message, ask yes/no questions or have the speaker write his or her message to you. Thank you.